Welcome to Life in Focus, where we focus on vision care, eye health, and the latest treatments to help you see and feel your best. Today we're here with Dr. Brad, who's going to talk to us about the latest in dry eye treatment. He has been a wonderful asset to the practice and patients. If you can let us know a little bit about yourself, Dr. Brad, and what you're doing.
All right. Thanks for having me. I appreciate it. I have been with this practice now 8 years. I moved here from Miami. I've found that up here we have a phenomenal patient base where we're able to really work to the extent of our abilities, and there is so much need here that I'm really excited about what we've now developed, and that is over the last 5 years we've come to develop a dry eye clinic, and that center it's now come to fruition where we actually have some very effective treatments for patients with dry eye, from mild dry eye all the way up to the most severe cases. We do have things that can help patients.
Yeah, so many times when we experience dry eye patients, all we've done for them is give them over-the-counter drops, lubricants. So we commonly hear complaints, oh, my eyes feel tired, gritty, my vision fluctuates. And historically, what we've done for them is just give them Systane or Refresh, just an over-the-counter eye drop. However, with the more severe cases in which the cornea appears to get damaged as a result of the severe dry eye, we now offer much more advanced therapeutic options in addition to pharmaceuticals. However, this particular treatment approach allows for a more improved function of the tear glands, the meibomian gland specifically. So Dr. Brad, tell us about the 3 different layers of the tear film, and which layer specifically are we targeting, and what glands do we find most impact dry eyes?
Okay. So there are 3 components to tears. There is the aqueous component, which is essentially the water component. There's the oil component, which is produced by the meibomian glands that probably this clinic is pretty much set up to treat them specifically. And then there's a mucin layer as well. But what we find is that about 86% of patients with dry eye, it is related to meibomian gland dysfunction. Now, these are a group of glands that are that come up through the eyelid, open between the eyelash and the eye on the surface of the eyelid. And there's about 25 glands on the lower lid and about 30 some on the top. And for reasons that we don't exactly understand, and certainly not the fault of the patients, for some reason in a very high percentage of people, these glands malfunction. Malfunction can express itself from styes and multiple lumps on the eyelids, to chronic irritation, to then the other side of the spectrum where patients have severe dry eye that can even result in corneal decompensation, or the cornea just starts to not function properly anymore. And these patients tend to become very uncomfortable, their vision goes down, and it becomes a very serious eye problem at that point.
Yeah, so historically speaking, when we approach these patients, we prescribe them Xiidra, Miebo, and many of us have heard of Restasis, and these are therapies that require long-term, indefinite treatment. So they're going to be on these pharmaceuticals forever. What I love about this new treatment, it specifically targets the function of these meibomian glands. Not only is Dr. Brad identifying the osmolarity of the tear film, but he's also identifying the actual imaging and the dysfunction within the glands themselves. So allude to some of the treatments when you do find that some of the meibomian glands just aren't quite functioning, or when the tears are a little more salty than they should be on the tear osmolarity.
All right. So in the past, like you alluded to at the beginning, all we had to offer patients were more lubricants. And those lubricants, what we found is that lubricants with preservatives in them actually may contribute to the patients feeling more dry. So we've developed a whole system of drops that are non-preserved, that have different components to them than normal eye drops. If these things do not help the patients, and we find that we need to go to further work, what we do is we have a system we have instrumentation that we can help go in. We heat up these glands that have become static. The material that should come out as oil becomes this waxy substance that stays inside of the lid. So what we use various techniques to warm up those lid areas, to warm up the glands, and then I individually go gland by gland and actually express the material that's in them. And as we do that, over a period of time, we get more and more glands coming back online where they have not been functioning, sometimes for years or decades. With a bit of work on our part and then some homework with the patients, we're able to get these people more comfortable, get their corneas back in shape, and overall just improve their quality of life, because they're not always thinking about their eyes and the feelings of dryness and irritation and fluctuating vision and all of the things that come with chronic dry eye.
So in addition to expressing the glands, getting those glands functional, we have two wonderful new devices that were recently developed here in the United States, one of which is IPL, Intense Pulse Light Therapy, and LLLT, Low Level Laser Therapy. And some of the equipment is located right behind us here. So as Dr. Brad releases the glands, opens the glands up, the goal is to restore the function of these meibomian glands so they have much better long-term success. Give me an idea of the approach you take using these new devices.
What we've found is that a two-step approach prior to me opening the glands works very well. We use the IPL unit here, which was first developed in dermatology, but dermatologists started to find that their dry eye patients were doing better, and so we sort of moved it into eye care. But what we do is we treat all around the eye, and what this does is that intense pulse light, it is absorbed by the glands, it heats up the material inside of the glands. Even just as importantly, some of these abnormal blood vessels that grow around the gland openings are also reduced with the intense pulse light. Once we do that, then our next step is to use the array of the low-level light therapy. What we found is by targeting different wavelengths, we're able to predict the depth of which the light will penetrate, and depending on what we want to do, we can take care of pigmented lesions, we can take care of fine lines and wrinkles, along with the fact that we are working on these meibomian glands. When we go to the red light therapy, then that again, what we're finding with this is that there are clinical studies that show that what we're doing is we're actually healing the tissue by increasing mitochondrial actions in the cells and ATP production. We're able to actually get the tissue functioning more normally again.
And that's where I'm most excited. Instead of us prescribing a pharmaceutical that you would have to be on, we're actually restoring your natural function. Just to give an example, I had a patient recently that had severe watering, burning of the eyes. She could not work on the computer for longer than 10 minutes. She comes through the dry eye spa. Dr. Brad does some treatments, intense pulse light therapy and some low-level light therapy. And within 6 weeks, she is extraordinarily better. She's able to work on the computer much more comfortably, much less tearing, much less use of her over-the-counter drops throughout the day. But these are the success stories that we are seeing coming through the office. Truly exciting. Now, once these patients are through the low-level light therapy, what can we do to help keep the glands healthy and functioning as they should?
Well, that's something else that we kind of turned on our head, and that is that, and for years, at least myself as a practitioner, I was always sending patients home with lid scrubs and tears and other things to do at home. And what we've found is that these conditions actually need medical help prior to sending the patients home with the home maintenance. Now, doing the maintenance first really wasn't helping the patients very much. But now that we've found that once we do these treatments, we send them home with some very easy, daily maintenance things, we're finding that we're able to keep these people comfortable for a great long time after we've finished the treatments. So some of them are now even approaching a year out, where when we come back for follow-ups, I never have dry eye patients where I say, "Hi, how are you doing today? How are your eyes feeling?" And they say, "I'm feeling fine. And I say, really? Yes, I'm feeling good. So that's really gratifying, because it's difficult to get dry eye patients that have severe dry eye to ever really feel like their eyes are feeling better again. And what we have here, we have patients that come back and say that their eyes feel better, or that the dryness is gone completely. And so that's something that in my career, I've never had other dry eye patients that have said those things. And so it's really, really tells me that we're onto something here.
Very, very exciting. So patients, we've always had supplements such as fish oil with DHA and EPA. We are now discovering that there are some other ingredients that are particularly helpful in the context of dry eye. And Dr. Brad has been experimenting with some great success with some of these newer supplements. Can you help us understand some of them?
What we're finding is that through experimentation, one of the types of supplements that is very helpful are supplements that contain black currant oil, and so we offer those here. They're also readily available. There's also some suggestion that some of the pigments that are helpful for patients that have macular degeneration and other retinal issues may also have an anti-inflammatory effect on the eye. So right now, we're also adding some of these same types of pigments that are used in treating macular degeneration for dry eye as well.
Such as lutein and zeaxanthin.
Zeaxanthin and
astaxanthin.
Exactly.
So GLA is the common omega-6 fatty acid found in blackcurrant oil that has been found to be particularly helpful. So in addition to these dry eye treatments, we send the patient home with a nutritional guide to help them as they take on this endeavor. So Dr. Brad, just to summarize, what are some actionable steps that people at home can take to keep their dry eye at bay and preventing long-term damage?
Great question. If it is in the earlier stages and they may not, need the level of care that we're providing here, things that are incredibly important are staying hydrated. It seems like all of us have some amount of screen time every day. If you do have excessive screen time, taking regular breaks really does make a difference. If you're able to do that, step away from your screen, blink, walk around a little bit. Using humidifiers. I know we live in Florida, but we also have very over air conditioned air, and so sometimes actually a humidifier can be helpful in patients that have chronic dry eye. Keep in mind, ceiling fans that we all find almost absolutely necessary are also a big culprit with patients with dry eye, so managing ceiling fans is also important. And then the one thing that I would like to convey is that lots of dry eye patients are used to kind of suffering in silence because they have not found very good help over the years. What I'm appealing and what Dr. Mark is appealing to is that we now have things that we can help patients that have been suffering for long periods of time. Don't suffer. Come in and see us, and we have things that we can do to help you feel better.
And again, the earlier, the better with the outcome. Thank you so much for your time.
Thank
Hope
you.
to see you next time.
Thank you, Dr. Mark.